My name is Ty Claver. I am a third-generation Klamath Basin farmer and rancher. The basin is a very marvelous place with, so much diversity in it. It's, a place that I'm very happy and very proud to call home.
Slow down.
Slow down and move over.
And move over. When you see lights,
vests,
or reflectors,
please give us some room. Slow down and move over.
When you need us,
we've got your back.
Do you have ours?
You got our back?
You got ours? You got our back?
Please, slow down
and move over.
This live broadcast is brought to you by CalOr Communications, the official broadband partner of Klamath Falls News.
Hello friends, Brian Gailey of Klamath Falls News. Welcome to Ask Klamath, presented by Pacific Crest Federal Credit Union. We're back. It's been almost a year since we've been able to do the show. It's been COVID, it's been the pandemic, it's been some personal health issues. There's been a lot of things going on. But we're back. We're here. We have Valleree Lane is our guest here today. Valeree is the Public Information Officer for the Klamath County Public Health. You were one of our last guests last year, just before the pandemic kind of kicked off. We were talking about myths and things like that then. But this time, we're going to actually talk about the current status of the pandemic. We're going to review the county's handling of how the pandemic has been. Has it been good? Has it been bad? We're going to talk about what's next, what's kind of on the horizon, and we're going to be taking your guys' questions live here during the show. But before we do all that, Brandon, roll that intro. Hello, everybody. This is Brian Gailey. Ask Klamath, presented by Pacific Crest Federal Credit Union. This is episode number 65, airing live on March 10th, 2021. Joining us here today is Valeree Lane, the Public Information Officer of the Klamath County Public Health. Valeree, can you kind of talk a little bit about what is the Public Information Officer? What do you do over there?
Okay, first I want people to know that I've asked you not to wear a mask, that I had COVID-19 in June of last year, which means that I'm not a threat to you or Brandon, and you're not a threat to me. And I believe that people can better understand us when we're not masked.
Not as muffled, that's true.
Okay. So Public Information Officer is the person who ensures that the information is gathered and disseminated out into the community. So I'm responsible for the website, I'm responsible for the press releases. If people call in and have some general questions that they want to ask, not just about COVID, but I'll probably be the one that gets to answer their questions if they're concerned about the open burn that'll be coming up next month.
A lot of things on the horizon, isn't there?
Sure, absolutely.
Always something to do.
Yeah.
So we're going to get right into the questions that we have here for you, Valeree. And if you've watched us before we took some time off, we've been around 64 episodes. We're kind of changing things up a bit. We're trying for a shorter show, so it's easier for you guys to watch. We're going to get into things a lot quicker. So I want to get straight into some of these questions. after a year of dealing with the pandemic, masks, stay-at-home orders, do you think the pandemic's on a downhill trend?
Only time will tell, Brian. At the end of the day, what we're beginning to see is that there are less cases being reported in Klamath right now, and it looks like nationwide. So hopefully we are about to see a lull, and with the vaccination coming in, hopefully we're going to see this die down some. But again, it's new territory. We'll see what May brings.
Do you think there's going to be a resurgence in maybe a new strain? You hear some of this European strains and things like that. Is that something we got to worry about?
So at the end of the day, every virus mutates. That's just what they do. That's why we have a different flu jab every year. So there have been mutations already with COVID-19. There will probably continue to be mutations. The question really becomes, with the vaccine, will the vaccines be good enough to hold up to the mutations, or will we be seeing a new vaccine periodically to keep us up to date?
Kind of like an annual flu shot.
Exactly.
It would be kind of nice if that does go that way. Maybe we can get the flu and COVID rolled into the same, and you only get poked once.
I am not the person to tell you about the way that works. So, but potentially, if there is some symbiosis there, I think that those could be pulled together, because you look at, measles, mumps, rubella; those are all taken at the same time.
Right. So looking back, it's easy to look back and go, well, this worked, this didn't work, right? Hindsight's 2020. If we look back at what the county has done, not necessarily the state, but at the county level,
right?
What do you think you guys got right going into this, and what would you have changed if looking back?
So I think one of the great things about living in this community are the relationships that we build day in, day out. And the fact that we already had partnerships with a variety of different health providers, whether it was the EMS folks that are on the front lines, the hospital, the different clinics. We had that going for us. We already had the established relationship. We were able to get into a sync, so to speak, about how we approached this really early on. We were one of the first counties to have a case. And I think that we were really pretty successful learning from Washington County, which was the very first. Mm-hmm. So when Washington County had its first case, they released way too much information about that individual. She actually became a person who was targeted in her own community. There was a Facebook group specifically sort of targeting her. And so she had some issues trying to get back into the community in a way that was safe and healthy. And so we knew that we wanted to be very confidential about who that first case was. We continue to hold that confidentiality. It's what we would do if you came to our clinic and were tested or were using any of our services. That HIPAA stuff we take very seriously. When we think about what we could have done better, I think most of us were paying attention to what was going on in China. So we knew that there was the potentiality of something that was going to be larger than just China. But I don't believe that I personally, and I think that the four of us on the team, didn't have the sense that it was going to hit us as soon as it did. So we saw our first cases in the United States on January 15th. And by March 7th, we had our first case. Now, we're right here on the West Coast with Seattle.
Right.
But I think that there was, for me at least, a sense that, okay, this is in a large populated area. We're not necessarily the most populated area. But it was also during that period of time that we were beginning to see our teams travel for national playoffs with the Owls and for state playoffs with a lot of the other teams. And ironically, that didn't play into our first case. Our first case came to us, I'm not going to say unexpectedly, but I think sooner than we would have anticipated.
Yeah. So lots of things to learn, right? Moving forward, everything's a learning experience, right? We always learn from our mistakes and things like that. And there unfortunately was a few made, but there was a lot of good successes made as well. Absolutely. I know a lot of our audience would always be looking for more information. Where did somebody work? Where did somebody recreate? Where did they shop? So that they knew those places to avoid. But due to HIPAA, as you said, a lot of that information can be released.
Right, exactly. So you don't ever want somebody to be put in a position of being compromised. the woman who was one of the first cases, or the first case in Washington County, her life has been affected forever. And she was targeted. In our community, the reality is that with the precautions that were put in place, even really early on, you weren't going to go grocery shopping and be subjected to contagion. We can make personal choices every day. And at the end of the day, we're responsible for our health and ensuring that those around us are not compromised. So we're not trying to take this lightly, but the reality is that we're not going to give you more information than you really need. And I wouldn't tell you about somebody that was exposed to rabies where they had just been. So I'm not going to tell you that about COVID either.
Understood. So, you guys, if you probably noticed there on the corner of the screen, the One-Way logo there on the side, One-Way Auto Glass is a proud sponsor of what we're doing here at Ask Klamath. Dave is probably one of the most knowledgeable guys, the most knowledgeable guy I know when it comes to automotive glass. 30 years experience. He's done it all: tinting, repair, replacement. He does custom glass for your hot rod. Dave can also wrap your vehicle for a custom look without a brand new paint job. Hoods, trunks, stripes, doors, wheels, you name it, he can do it. He's even done a refrigerator. He wrapped a refrigerator so it would look a little bit different. Give Dave a call if you would. He's a proud supporter of what we're doing here. I appreciate you supporting him. 541-331-1432 to see what he can do for you. Search One-Way Auto Glass over on Facebook as well. And if you do something, let him know we sent you. So we're about to take our first commercial break. We got Valleree Lane here. If you're just tuning in, she's the Public Information Officer for Klamath County Public Health. We're going to be talking more about what's going on with the current state of the pandemic, being a year in. But we're going to get to that right after these messages. Guys, we'll be right back.
My name is Ty Claver. I am a third-generation Klamath Basin farmer and rancher. The basin is a very marvelous place with, so much diversity in it. It's, a place that I'm very happy and very proud to call home.
Slow down.
Slow down and move over.
And move over. When you see lights,
Vests,
Or reflectors.
please, give us some room. Slow down and move over.
when you need us.
We've got your back.
You have ours.
You got our back?
You got ours? You got our back?
Please, slow down.
And move over.
Hello, friends. Brian Gailey here. Welcome back to Ask Klamath, presented by our friends at Pacific Crest Federal Credit Union. Today, we're talking with Valleree Lane, the Public Information Officer of Klamath County Public Health. This segment is actually brought to you by our friends over at Coastal Farm and Ranch, serving you in the Pacific Northwest at 17 locations, including Klamath Falls right here at 1776 Avalon Street. Coastal is now offering country convenience with online ordering and pickup right in the store. Head over to countrycoastal.com. You can shop there, pick up in store. Since 1963, we're just what the country needs. Coastal Farm and Ranch. Thank you, Coastal, for sponsoring Ask Klamath. Valleree, I want to get back into some questions here. Do you believe that we're going to get back to normal? And by normal, I mean pre-COVID life that we were able to experience. Do you think we're going to be able to get back to that anytime soon? And how much, if not, how might that look?
So I would encourage everybody to pay attention to what Dr. Fauci is saying. Dr. Fauci is the national expert, so to speak, of virology. So at the end of the day, he's talking about us having to wear masks until 2022, and that we're really not quite sure yet exactly what it's going to look like when we do get back to normal. Will masks always be part of our lives? I don't know. Will we always be looking for that distance? We live in rural America. We like our distance anyway.
All right. Do you believe, thinking vaccinations, I know we're going to talk a little bit about vaccinations here in a minute, but do you believe that regular vaccinations are going to become a part of our lives moving forward, kind of like a medical passport?
I really think that that's going to happen for us. At the end of the day, people have to keep that little white card that shows when they received the dose, what lot that was in. Johnson & Johnson at this point is a one-dose situation. I'm anticipating the state of Oregon is going to tell us we have to have 2 jabs of Johnson & Johnson. Pfizer and Moderna both are 2 jabs at this point.
How is distribution going in the basin right now? I think we just opened up to those at 65, right?
Right. So everybody 65 and older are now eligible, and people who are first line responders, whether they're medical folks, EMS, people who are caregivers, individuals who are being taken care of in congregate living situations, they're being taken care of. So just today is the 10th, yesterday was the 9th, we saw some folks who were living in more of a homebound situation vaccinated. So we're doing pretty well, and to be honest, we're seeing a lot more vaccine than I thought we would at this point.
So if somebody's now in that 65 plus group that's now being served with the vaccines, where can they get their vaccine at this point? And how do they do that?
Okay, so Skylakes has got an appointment line that they can call. We have that number up on our website. Bimart got Johnson & Johnson this week, last week too, I think. Fred Meyer's got some vaccine. Michael Sheets out at the clinics in Merrill and Bonanza has some vaccine. Our friends over at Klamath Open Door, they are serving their patients, as are Wholesome Family Medicine, and we anticipate in the coming weeks that we're going to see more clinics be able to vaccinate their patients.
Are there any pharmacies doing it yet?
So Fred Meyer, Bimart are the 2 pharmacies right now. I think Rite Aid is set to come online pretty soon too.
Okay. So guys, we're going to be taking your questions live. If you got any questions regarding those vaccines, go ahead and get that in the comments below. We're going to get to those in just a couple minutes. We're going to take another commercial break, but when we come back, we're going to bring up the soapbox. Valeree, you'll have a chance to talk about whatever's on your mind when we come back. Okay. Guys, we'll be back in just 2 minutes.
My name is Ty Claver. I am a 3rd generation Klamath Basin farmer and rancher. The basin is a very marvelous place with, so much diversity in it. It's, a place that I'm very happy and very proud to call home.
Slow down.
Slow down and move over.
And move over. When you see lights,
Vests,
Or reflectors.
please, give us some room. Slow down and move over.
when you need us.
We've got your back.
Do you have ours?
You got our back?
You got ours? You got our back?
Please, slow down.
And move over.
Hello, friends. Brian Gailey here, Klamath Falls News. Welcome back to Ask Klamath, presented by Pacific Crest Federal Credit Union. If you're just joining in, we are chatting with Valleree Lane, the Public Information Officer of Klamath County Public Health. We've already answered some great questions about what the county has done, where things are going, where you kind of see things. If you've got some questions for Valleree, we're going to be asking those in just a moment. Go ahead and get those in the comments below. We're going to be asking a handful of those questions, or a few of those questions. This segment is actually brought to you by our friends over at the Klamath County Fairgrounds. They want you to mark your calendars and get your consignments ready, because the spring consignment auction returns on April 17th, where you can buy, sell, and bid on ag equipment, vehicles, tools, household items, and so much more. Friday, April 16th is the preview day, with, again, the sale on the 17th. The spring surplus auction is run by Dupree Auctioneers and is a benefit for the Klamath County Fairgrounds Event Center. But you can learn more about the auction and start to see some of the items that are up at DupreeAuctioneers.com. That's DEUPREE auctioneers.com. So, as I mentioned before the commercial, this is a time where we kind of talk the soapbox. This is a chance where you get to talk about what it is that you want to talk about. What would you like to discuss today?
You know, I think that people need to understand how great it is to live in the Klamath Basin. I believe that all of our friends and neighbors have done their level best to be as helpful as possible throughout this entire year. When we see people who fell ill and needed help getting groceries, needed help getting medications, there were people who stepped up to do that. At the end of the day, I believe that we're never really truly going to be the same. There are a whole generation of young people who have had their educational careers changed in a way that we couldn't have perceived this time last year. And I think that we need to be really thoughtful about the fact that people are doing the level best they can, and hopefully we can give people the grace of knowing that no one is intentionally trying to make other people uncomfortable, hopefully, and no one is trying to force vaccines on anyone. No one's saying that you absolutely have to approach this the same way as someone else, because again, we live in a community where we appreciate people with their own perspectives. And at the end of the day, my responsibility is to ensure that you have the best information to make the best decisions.
All right. Yeah, so there's a lot. It's a lot, right?
Yeah.
And it's not the only thing you guys are dealing with down at Public Health too, is it?
No.
There's COVID was just kind of one of the things. You guys deal with a lot of viral issues or widespread infection issues and things like that too, right?
So we have a responsibility every day of the year to ensure that we're monitoring communicable disease in the community. In addition to doing that, we have a clinic where we take care of reproductive health issues, which is usually just birth control and family planning. A lot of STD tracing, not to be immodest, but there is a lot of that communicable disease in our community. So the numbers that we saw at chlamydia this time last year are higher than what we saw today, because people aren't necessarily being tested for that the way that they were in the past. Hopefully people are being safe. They're making choices that they want to keep safe and healthy. Our environmental health folks are making sure that restaurants are where they need to be, that wells are taken care of. And we've got the Women, Infant, and Children program where families receive that nutritional support that they need in the first few years of a child's life. So there's a lot going on there. There's 4 of us on the COVID team, and we've had some spikes in numbers around the holidays, and there were a few other people that got called in that are assigned to other tasks but have helped us with tracing of the disease. And people got really kind of concerned about contact tracing, and contact tracing wasn't the big issue. The big issue is ensuring that we understand where a person might have been exposed to that contagion and how we can help them be healthy moving forward. And if somebody was potentially exposed, letting them know that they needed to quarantine and be away from people so that they weren't passing that along.
Very good. Thanks for the information.
Sure.
We'll take some questions here at this moment. Brandon, what do we have for questions for Valleree?
Hello, everybody. first question will be by Tanya Garrison, and she asked, how much funding did Klamath County Public Health receive from this COVID situation, and are they prepared to give itemization of funds and spending?
Sure, Tanya, thank you for the question. I do not have the exact figure right here with me, but if you go to klamathcounty.org, towards the end of the page, there'll be a request for public information. If you fill out that request, because everything we do is public information, you will be able to receive that information.
Okay, very good. What else do we have, Brandon?
For our second question, we have Mark Wyrick. Why has every disease and ailment decreased and the overall deaths in the country stayed the same since this assuming pandemic?
Mark, this is my perception, and it may differ from what other people would tell you. We have focused for a year now on COVID-19, and I would tell you straight out that there's a difference of dying of COVID and dying with COVID. So that there are individuals who have definitely passed away because COVID got the better of them. There are individuals who tested positive for COVID and passed away. You might know that a couple of months ago, Josephine County refused to take a COVID death in their numbers, and they said that the state of Oregon could call it a COVID death, but they as a county were not going to call it a COVID death because it was a motor vehicle accident. The woman had tested positive within 90 days, and so by the state's definition, that became a COVID death. But the medical officer in Josephine County said that is not how she died, and they refused to take that into their numbers. We have become fixated with COVID. There are people who hold their own spreadsheets of information that I release. They'll let me know if they think that I blew it in the numbers that I've presented. And I appreciate that. But there is almost an overwhelming sense that COVID has been life for a year. Will we have the data to be able to go back and tell you that, yes, a person had breast cancer, they passed away, they were COVID positive, but breast cancer was probably the largest contributing situation? I hope so. I really hope, as a professional communicator, that there's going to be people who come down the road another 5-10 years and look seriously at how did we talk about this and how did we pursue the information? Because I believe that there are lessons to be learned about this, not just about washing our hands and wearing masks and keeping distant, but how did we interact with each other? How did I give you information about how to be safe and healthy? And I believe that there will be scholars down the road that will be able to tell us, you know, these are the things that you did pretty good, but these are the things that you really should have done differently. And I hope we take those lessons to heart.
And like I said earlier with the questions, hindsight 2020, right? It's easy to look back and criticize what did or didn't work.
Right.
Then in not to defend anything or whatnot, but it was a very fluid situation, meaning things changed quickly and often, and sometimes contradictory to itself.
You know, one of my really strong memories early in the Oregon situation was our guidelines were changing almost a few times a day. So you could call and talk to me at 9 a.m. and I would tell you, I'm expecting this to be rewritten throughout the day. This may not be true at 3 p.m. And oftentimes it wouldn't be. So what we know today is not going to be what we know tomorrow. And no one, to the best of my knowledge, is trying to mislead anyone. But I've made my career out of saying, this is what I know right now. And if I have better information later, I'm going to give you better information.
Very good. Doing what I do, I greatly appreciate the information you do provide as well. So it's a great asset that you have been doing as well. Brandon, I think we might have time for one more question. Do we have one ready to go?
We have another one by Tanya Garrison, and she asked, why were there so or little to no flu cases?
Okay, Tanya, again, this is my perception. I don't necessarily have data to show this, but when I last looked at the number of flu tests that were run this year in the state of Oregon, there weren't as many flu tests given. So my perception is that we may have had fewer flu cases, but we won't know because the tests weren't taken. I also believe that we were really, again, very much paying attention to COVID. So if you presented with respiratory issues, you would be tested for COVID. And I haven't spoken with a doctor to find out, are you doing a flu test and a COVID test the way we did 1 year ago today? Or are you focusing more on the COVID? There's a perception, I think, nationally. I just saw a piece over the weekend that says that because we've been washing our hands, because we've been monitoring the contact we have with others, that flu didn't get the stronghold that it usually has season to season. That's a possibility. But again, I think that that's one of those pieces of research that we're going to know better probably in 3 months than we know even right now.
Time will be the telling factor on a lot of that.
Absolutely.
All right. Well, Valeree, that's about all the time we have for today. I want to thank you, and I appreciate you coming down and discussing with us here on Ask Klamath, presented by Pacific Crest Federal Credit Union. And I want to thank all you guys out there for watching our first episode back in nearly a year. This is our 65th episode of Ask Klamath. We're happy to be back and bringing you this show once again from our studios here at Klamath Falls News. If you did not catch the entire show, that's okay, because as soon as Facebook's done doing its magic, you can rewatch anytime through our archives there on Facebook, as well as over at askklamath.com. If we've entertained you, if you learned something, give us a like, share it with your friends, and let them see this interview as well. Ask Klamath is a production of Klamath Falls News, and next week we're actually going to have the new fair manager, Derek Rowley, is going to be coming and joining us here in the hot seat and talking about what's happened at the fairgrounds this past year and what they've had to deal with as well. On behalf of my guest, Valleree Lane, I'm Brian Gailey. Guys, we will see you around the basin. Good night.